this works. But I'm going to leave it to Chris to kick it off and let everybody else kind of do the talking.
Sounds good. Well, thanks everyone for coming. We'll try to make this quick and informative, but again, we wanted to say thank you, first of all, for being so responsive to have a group this big and to get within a week a quick response on the employee survey that Flip talked about that we needed everyone to fill out. That makes all of our jobs easier, especially Jerry's job, and I'll introduce, this is Jerry, by the way, from Bucati Companies, and Jerry's going to take us in detail through our plan, through our new plan options, and then hopefully we'll have some time at the end for you to ask any questions that you might have with Jerry. So I thought I'd also point out, as Flip mentioned, why are we here today to talk about this is basically because, unfortunately, healthcare costs are going up. We all hear about that. It's not unique to us. It's happening across the nation to all companies. Our health plan went up approximately, to keep the prior plan, over 45%, which is pretty astonishing. I don't think anyone wants to keep something that's going to go up that much. There wasn't anything we could do about it. So what we did is we immediately triggered, Kim and I did some discussions with Jerry, who came out and was really helpful in guiding us through this process. And the first step was to do the employee survey. So again, thank you for filling that out quickly. That gave us the required information for Jerry to then take that to the marketplace and in essence shop it around at other carriers. Once he did that, he brought back to us a complete menu of different options from different healthcare providers, of which Kim and I reviewed those with Jerry, and then we also reviewed them with Flip, Brett, and Troy, the executive group, and we came to some decisions on what we thought was an excellent balance of a reliable healthcare provider. And in fact, United Healthcare is a larger provider than our current Aetna provider, so that's a very big positive thing. It's a larger network. The second thing is it still needs to meet deductible reasonable limits, out-of-pocket reasonable limits, as well as reasonable premiums that would be paid both by the associates as well as the company. And so that was our process. We selected that not only for the healthcare plan, but then as well, you'll see Jerry present to you different options that we're changing on the voluntary insurance plans, as well as dental and some of the other ancillary insurances that all come along with our annual selection. With that, I also wanted to make sure that you all understand, since I am the numbers guy, remember we talked last year about the company last year increased its contribution to the associates to a 70%, 30% share. The company still, even though our healthcare went up this year, maintained that generous contribution to all of us. The company is still contributing 70% of the healthcare premium costs on all of your behalfs, whoever is using the healthcare plans. And that, to me, at all the other companies I've been to, that's almost unheard of, and Jerry can probably attest to that as well because he sees a lot of other companies. So I'd personally like to say thank you to Flip and just say, I think, a round of applause because how generous that is. With that being said, we're going to keep doing that, and even though premiums went up, it did not go up as much as what it otherwise could have. And I'm going to turn it over to Jerry, unless Flip, Brett, or Troy, anyone has any other comments you all would like to make.
I will say one other thing is that, having, run multiple businesses, because there's a number of you in the room, two of you could add up and I'd still beat you in age, that there are a lot of different ways to do things. And I have not gotten very involved on this for a number of reasons. Probably one of the reasons is the size of our company, and that it was easy because Kim and Chris could handle this. And when I say handle it, is we just didn't have very many options. So those are the options, that's what we did. Where now with this, what I would call a horrible situation, a raise of this much, then I will actually get more involved. And what that means is nothing more than supporting Jerry and what he might say about all the other things we can do like we can, the company can self insure, and before people that know what that means don't go crazy, because self-insure might mean something as simple as we would have a higher deductible, but the company would take the risk and it would pay that higher deductible, thereby still lowering your deductible. And again, I don't want to get into those complicated things, because that would be something that the executive team and a few others like Kim and Jerry could help us look at what some of those options are. So there are always more than one option to get insurance. Just know the number one factor is having excellent insurance and trying to give us the best benefit that we can for the company. That's the foundation we're going to build upon. There could be a time when insurance gets so crazy we cannot afford to do some of the things. It's out of my control. But at the same time, as we're going to open up a new division, I think that's going to bring a lot more profits to the company. When that happens, then as you know, the company will be very generous and give back to it. I'll show
So with that, we'll let Jerry go ahead and start on the detailed stuff. And again, I would stress to you all more than anything, if you don't understand some of this or you have questions, ask Kim or ask Jerry while he's here. We're here to help you. Okay, we don't want people stressing out and getting upset about change. You know, and I think everything I've worked with Jerry and the folks at Buchanan have been phenomenal to work with and explain a lot of these things, even to us, as we're trying to figure out how to navigate through this. So with that, I'll turn it over to Jerry.
Yeah, thank you, Chris, and thank you, Flip. I can attest that the benefits offered here are quite phenomenal. The fact that they offer the 70% across the board, so for you to have families to cover, dependents, spouses to cover, it's pretty unheard of now that we've seen a lot of companies pull back on offering benefits to dependents of employees. So just note that it is a great plan that they're still offering you here. Yes, did we have to take a minor hit or major hit, that is, but we were able to offset it by moving to a new carrier, United Healthcare, as you guys have already seen and you've seen in the packet. And before I kind of get started here, does everyone have this packet in front of them right now? That's great. All right, so I'm not going to be addressing the packet too much. This is just going to be more for you to take home. I'm going to be going through the PowerPoint here on the screen here. I don't know how to work this.
We got to point it up here. It's up there. Oh, yeah, okay.
We should call IT.
Yeah.
What are we gonna call them?
All right, perfect. Okay. Simple trick now. All right, first I'm just going to go over the Buchanan benefits that you have available to you. So instead of having you all call the 1-800 number on the back of your card, whether it's United Healthcare, whether it's Guardian for the dental plan you're switched to, whether it's IMED, a vision plan, or Mutual Omaha, where your ancillary benefits are going to go through, we'd rather have you guys call us. We have a direct concierge level status with every carrier that we represent and have in place here at Legacytouch and BBAJ. So whenever you guys do have a problem, whether it's a network claim, problem with getting an ID card, question about what your insurance covers, any questions regardless, Marcia Crummel right here in the middle is your go-to liaison. You can email her, you can call her, her information is in the packet. If she is not available, you can call Cecilia or myself, and we'll be more than happy to help you all out. If it's an emergency, please call us. We know who to talk to. We can get things done in a little more expedited and accurate fashion. It's stuff that mind reading. Don't think like you're bothering us. This is what we're here for. We're here to help you all out with anything concerning the benefits that are in place. As you kind of have already seen, here's what's kind of new coming up for March 1st, and that's when everything is renewing. So here in about 25 days. Obviously medical, switching from Aetna United Healthcare. Dental, switching from Lincoln Financial to Guardian, which I know some of you probably be excited to do. Vision, switching from Lincoln Financial to IMED. And then the life, the voluntary short-term disability, the voluntary long-term disability, switching to Mutual of Omaha. You have 3 plan designs, so we're adding a plan design. At first, you guys only had 2. And you'll see that you've got a kind of little bit of an outlay here that kind of makes it a little bit easier to kind of see what the main differences are. Your base 1 plan, it's a $4,000 deductible, and one being the same, the out-of-pocket maximum being $4,000 as well. So they all attribute to the same thing. It's not in addition to, so you're not going to, if you're on an individual level, it's not going to be $8,000, it's just $4,000 that you have to hit, and then everything is covered at 100% from there. So this is going to be your lowest premium based on the fact that it's the base 1 plan. It's going to be your highest deductible and your highest out-of-pocket maximum. All 3 plans access the same network as well, okay? So one thing I'm going to highlight there, and they all have co-pays and everything, which I'm going to dive into a little bit more detail here. Then you'll see base plan number 2, obviously just a little bit less with the deductible when compared to base plan number 1. But you'll see that the out-of-pocket maximum stays at $3,000. And when you compare the base 2 plan then, moving on to the buy-it plan, you'll see that the out-of-pocket maximum on this plan is $1,000 less. Even though your deductible though on that buy-it plan is $1,000, your out-of-pocket maximum is only $3,000. So if you are someone that knows that they're going to hit their deductible out-of-pocket maximum this year, this middle plan, this base 2 plan, might be the one that you want to be on. If you're someone that maybe doesn't think that they're going to use the insurance at all and just wants to pay the lowest amount of premium, maybe you're going to look at base plan number 1. If you're someone that likes to have the comfort of having a lower dollar deductible, having that co-insurance set in a little bit earlier, you like the lower dollar co-pays to go access doctor's office visits, that's going to be for the buy-up plan. All right, so just that's a simple rundown. I'm going to go through these in a little bit more detail coming up here. As I kind of mentioned, obviously we're kind of diving in there just a little bit, but if you're expecting low to moderate usage, look at that base plan. Expecting higher usage, look at that plan 2 plan, or maybe look at the buy-up plan as well. Obviously, if you're faced with unexpected expenses that you can't afford, maybe that high deductible plan might be best for you, as well as if you're faced with unexpected that you might not afford, maybe a higher deductible plan. That base 2 plan, that's still considered a high deductible plan, but still gives you a good benefit, the fact that you're only out $3,000, and that's all you're out there for the year. Full medical insurance code, insurance 101 here. All 3 plans have copays. All your copays apply towards your out-of-pocket maximum. They do not apply towards your deductible. That doesn't really make too much of a difference for those that elect the base 1 plan and the base 2 plan, but for the buy-up though, just note that they're not applying towards your $1,000 deductible, they're applying to your $4,000 out-of-pocket maximum. So think of it as that you're going from the top down on your out-of-pocket maximum. But when you're accessing your deductible related claims, that's working from the bottom up. Also, obviously all your deductible then portion goes into your out-of-pocket maximum, and that's only for emergency room care, urgent care, inpatient, outpatient care, all applying towards that deductible. After you hit that deductible, co-insurance then sets in. Your 2 plans on the base 1 and base 2 have 100% co-insurance. As mentioned, that deductible and out-of-pocket maximum is the same. You don't pay anything more. On that buy-up plan though, you have a $1,000 deductible with 80% co-insurance. So once you hit that deductible $1,000, 80% co-insurance kicks in, leaving you liable to pay only 20% up to the out-of-pocket maximum of $4,000. You've got it right in front of you in your packet, but here's just more highlights on everything. So I'm just going to drive in on something I haven't touched on just yet. One is being the office visit copays. To go visit a primary care physician, $30. To go see a specialist is $60. You do see this UHC preferred right here. If you go within the designated network of UHC to go see a specialist, it's actually only $30. $30 savings to go see a preferred specialist. So you're talking about your cardiologist, maybe your orthopedic surgeon of some sort, if you have to have your knee looked at, anything like that. Those are considered your specialists in which you might want to check out if it's just for a regular checkup and you don't really have a go-to doctor that's considered a specialist. Look within the designated network of United Healthcare and save yourself that $30 on that copay. You're going to see a little bit more information that's going to be given to you after the fact, as well as it's actually in one of your UHC member brochures. But you all on each plan have what they call a telehealth or virtual office visit. Did any of you access the virtual office visit or over the phone visit with Aetna? None of you. Okay. So this is a great way to save time and save money when you just need to go in for something that's just a chronic illness, a cold, flu, eye infection, UTIs, anything on that, anything that's considered a non-emergency, something easy that can be diagnosed over the phone by a doctor. You will set up a portal actually, and so it's all in this member brochure here. If you dive into it on a later date, but you get signed up and everything, and you call in and you set up an appointment over the phone. You will talk to an actual licensed physician over the phone, and they'll tell you, you'll explain your symptoms to them, and they'll diagnose you with what you have, and they'll be able to write a prescription for you at your local pharmacy to go pick up. So it saves you the time and not having to go set up that appointment. It's accessible 24/7, so if it's on the weekends, on a Sunday, late at night, you can use this on your dependents as well. So great time saver. You don't have to go take the time, set up that appointment, wait in that waiting room just to get told maybe what you already know. Obviously, with the whirlwind of weather, you can hear it in my voice. It is so cold season. I'm sure you guys have all gone through something. It's a great way to access care at a limited price too.
How long does it take for them to get back to you when you call?
I would say usually it's under 20 minutes.
Under 2 minutes. Raise your hand if you think that you can self-diagnose some of your flu, cold, maybe a urinary tract infection, some of those things that are easy. Raise your hand if you think that you could do that and do that with a doctor. I will start because I guarantee I feel like I can. Okay. I didn't hear that. What?
I'm gonna do it after this meeting.
You do have this a part of your endo plan right now, by the way.
So we definitely need to learn about that because I had no idea, and golly, I mean, yeah, that saved me a lot of time when I'm going like, I know what I have, what, and so anyway,
I might also point out that when you look a little lower there, that urgent care, the $50 copay, I've taken my kids before because I know they have some kind of, sinus infection or something like that to an urgent care because they can't get them into their primary doctor quick enough. And we end up paying a $50 copay, and if I would have paid attention and realized that telehealth thing was there, I may only have paid $20 and accomplished the same thing.
Exactly. And just note if you are prescribed an actual prescription, a Z-Pack, antibiotic, anything like that, that is a separate cost. It's not just $20 over again. But just to access the care over the phone, though, $20. And I think, and I've had it done before, is that if you don't get any help from that doctor or anything, they will not charge you. I've had it both ways,
Right.
So
they
it's,
said we can't figure out.
say, hey, you gotta go see the doctor, you gotta go into urgent care. And speaking of urgent care and the difference compared with emergency care, it is a fraction of the cost to access care at an urgent care facility. I'm sure you've got one within a few blocks here to go access. So if it's not considered a true emergency matter, try to utilize that urgent care center. Like I said, fraction of the cost, way cheaper than accessing the emergency room. Usually when you walk into the emergency room, sometimes that bill's already up to $1,000 right then and there. So just note that there is a major savings to be had when utilizing urgent care center over the emergency room. One thing to highlight then as well is that all preventative visits, your annual physical, your woman's test, annual flu shot, being that it's done in network with United Healthcare or whatever care you may be with, all preventative visits are covered at 100%. Okay, and that goes for every plan that you have offered to you. So go get your annual physical done. Go get anything that they have. United Healthcare has a full array of everything they cover as a preventative visit. The one thing to be careful though, when you do access the doctor and go get in for your preventative visit, when they want to run maybe blood work, that blood work may be deemed diagnostic, and you could come back and be sent a bill after the fact by that provider. So just note that when you are accessing care, help educate yourself, ask questions to your doctors. Hey, is this still part of my preventative visit? Am I going to be charged for this? What is this for? Why are you doing this? So just note that sometimes it's not always communicated to you well, effectively enough by the provider. They're just going to take your insurance card and say, yep, okay, that sounds good. And then you're slapped with a $200 bill 2 weeks later. But all preventative services though, all three plans covered at 100%. This plan is considered, and all three plans are considered what we call an embedded deductible. So that means that even though you maybe have dependents enrolled on your plan, you yourself have your own individual deductible of $4,000. One being the same as that the out-of-pocket maximum is at $4,000 as well. So let's say you have a $10,000 claim, you're going to be liable to them and pay $4,000 of that. That's all you have to hit. You don't have to hit that full $8,000. You have your own separate deductible. Let's say then your child dependent has a claim. They go and hit their full deductible for the year. They're not covered at 100%. you've now reached the family deductible of $8,000. So anything that maybe another dependent or your spouse maybe has throughout the year is going to be covered at 100%. All right, so just note that if you do have dependents enrolled on your plan, it's not $8,000 that you each have to hit in total. You yourself have that individual deductible. Questions regarding the base one plan? All right, and you'll see the rates here, and these are in your packet and everything. Don't worry about the 52 pay period rates. Those are for the Star Excavation, another company under PBAJ management, but you guys are all obviously paid on 26 per pay period basis, so those are the rates that you should see in your packet there. I'm not going to touch too much now on plan 2 because it's the same thing as the base plan number 1. It's just the deductible and out-of-pocket maximum are a little bit lower. Obviously, as I mentioned before, if you do look at it, having something done that you believe you're going to hit your out-of-pocket maximum, this is going to be the plan for you. All right. Obviously, it's $1,000 less on both sides, $2,000 less on the family end as well. But co-pays are the same, prescription co-pays are the same, and so I'm just now touching on this. Your pharmacy benefit is the same for each plan. $10 for a tier 1 drug, $35 for a 2-tier drug, and $70 for a tier 3 drug. When switching care from a different carrier to carrier, you will maybe have to get prior authorization or a pre-authorization on any specialty drugs that you maybe are taking. So as soon as you get your information from United Healthcare, send that into your pharmacy, make sure it's a covered prescription, and if so, communicate with your doctor if it is not, or if it's covered in a different way that you don't like, and you maybe end up paying a little bit more than what you're paying today. Communicate that to your doctor and say, hey, is there another alternative drug that you can recommend to me that might be doing the same thing that is covered under United Healthcare? Same thing when accessing care in any situation. Make sure you get your information to that provider sooner than later, because if they don't know, they're just going to take it, and they might bill you for out-of-network services. Same thing, urgent care, $50 copay, emergency room services covered at a deductible. Same copays for the office visits, as well as the virtual visit as well. Pretty much the same plan that you got, just a little bit lower out-of-pocket maximum deductible compared with 1 and 2. Questions here? All right, you see your rates here, obviously are in your packet, and these will all be on Employee Navigator, so you'll see what your cost will be. And then comes the buy-up plan for those that maybe want a little bit lower dollar deductible and a little more intermediate, I guess, coverage that picks up a little bit sooner than having to hit that $3,000 or that $4,000 of your deductible before co-insurance kicks in. But as I mentioned earlier, $1,000 deductible, 80% co-insurance. You hit that $1,000 worth of your deductible, or your dependent hits that $1,000, co-insurance kicks in, you're only paying 20% then, up to the out-of-pocket maximum of $4,000. I mentioned earlier that your co-pays apply to the out-of-pocket maximum, not your deductible. So those are billing from the top down. So you have your deductible, and you have your office visit co-pays and your prescription co-pays that apply towards your out-of-pocket maximum. You'll see you'll pay a little bit less for office visits, $25 for a primary care, $50 for a specialist. Same deal if you go to a designated network for a United Healthcare preferred doctor, you're going to pay only $25 to go see that specialist. Urgent care, it does go up on the copay there, but by $25, so there is that difference. Emergency room though has a little bit better benefit that you actually have only a $250 copay plus 28% co-insurance, leaving you liable to pay that 20% co-insurance when accessing the emergency room. It's still going to be far cheaper to access the urgent care on this plan. Obviously, you see the copay just goes up a little bit. As I mentioned, all the pharmacy benefits are covered on the same chassis there, so it's a $10, $35, $70 copay system, all applying towards your out-of-pocket maximum. Any questions regarding this plan?
Why is the urgent care drug $25?
That's just how the plan designs are made. So, it's the United Healthcare Actuary is not $75 is justifiable on this plan, but
What was this question?
why the copay is a little bit higher. But you have a lower dollar deductible, so I think it's offset there. All right, you'll see your pricing here on the 26 per pay periods. Kind of briefly touched on prior authorizations. Obviously, they can be quite the headache if you do not get something that's pre-authorized and then go and have it done, because they're going to bill you a total amount because it's not going to be covered by the carrier. It is not up to you, though, to do the prior authorization. It is up to your provider to send to United Healthcare or whatever carrier you may be with, in this case United Healthcare, obviously. So when you are going in, having maybe a surgery that needs to be approved, you do have a higher prescription, a higher tier drug that maybe needs to be approved. Like I said, go to your pharmacy, go to your specialist, whoever that provider is, give them your new insurance card right away, saying, hey, I know I've got this coming up, and the nurse at the provider should be able to tell you, okay, yep, we're going to send this in and get this approved, and we'll let you know when it's complete. But just know that they're done to make sure everything is covered, that the doctors that they're going to be utilizing are covered, and then it avoids, and like I said, helps you avoid any type of unnecessary, uncovered medical treatments when accessing care. But just something to highlight there, since this is a carrier change. It's been a few years since you guys have changed carriers. Something that sometimes can kind of go back a little bit forgotten. Already mentioned that it's up to the provider, not you all, to get the prior authorization done. It's up to you though to initiate it, to give your new insurance information to your provider, but not for you all to then submit it to United Healthcare. It's up to your provider to submit it to United Healthcare. Any questions on prior authorizations or pre-authorizations? All right. You'll see in this brochure, this welcome packet that you've got, this is going to have a lot of basically the United Healthcare tools and value-added services, and I've just kind of named a few here. Upon getting everything signed up, they do have a smartphone app that can have your ID card actually loaded on there, so you don't always have to try to search for it in your wallet, or maybe because at first we're not going to have 10 ID cards, we're not going to have actual physical ID cards, we're going to have 10 ID cards. But you're going to have this available to you as soon as we get ID numbers, and you're going to be able to have it on your smartphone that you can pull up and give to a provider or give it to the pharmacy if and when needed. They have the Health for Me app, which also has the health, which then goes into health and wellness value-added services. They've got Real Appeal, which is a weight loss program, Rally, which is a diet and exercise program, all upon you get access to upon signing up for the United Healthcare plan, no matter what plan you're on. So just some extra incentives to get on some type of program to get a little bit more engaged with diet and exercise, and sometimes obviously get access to discounts with the program as well. But they've got a full array of information. This brochure gives you a little bit more information on how to get started, how to access the value-added services. And as we already touched on before, this virtual office is teledoc, no appointment ever needed. It's open access at 24/7. So.
Any details on the benefits or reduced costs for being involved with health and wellness?
You'll be sent a whole bunch of information that's going to show you, give you a wide array, what the actual discounts and services that are available to you. But I don't have anything on hand that I can put in front of you right now.
They're not a discount premiums.
There's no premium discount. But just a discount on to get on a weight loss program, to get on an exercise program, anything like that. Access to gym membership sometimes, instead of maybe paying that $70, it could be $50 that you get a $20 discount on, something like that. So, all up to you guys though, if you want to utilize them. They're just value-added services though that come with the plan. And then next, we're going to go into the dental plan. This basically mirrors exactly what you guys had prior with Lincoln Financial. This is now with Guardian, so I would say Guardian's got a little more of a vast network. You shouldn't see too much of a disruption. But one of those other things too, check with your dental provider to make sure that they're still in network. Just as I noted, shouldn't be too much of an issue to you all, but sometimes there are some gaps. But to highlight some of your plan benefits, per year, you have an annual benefit maximum of $1,000, and that is per person. So if you've got dependents enrolled on the plan, it's not all together, it's per person. Even after you've hit this $1,000, let's say you had some extensive work done, and you hit this $1,000 maximum, you are still going to be accessing discounts for having dental insurance. And that's usually in the range between 10 and 30% based on the provider and still what you maybe need done. When you go and access that preventative and diagnostic care, covered at 100%. So you go get your 2 annual cleanings per year, covered at 100%. Get your annual x-ray, covered at 100%. Then if you go into basic care and major care, you'll see in your package as well, you've got a whole Guardian packet here, kind of gives you a little bit more information. But they'll show you what's covered at 80%, and then major care that's covered at 50%. There is no orthodontia covered, but you do have access to discounts if you do need orthodontia work, or your dependent maybe needs orthodontia work and they're enrolled on the plan with you. One thing then to highlight before we move into the rates here, the annual deductible. If you're accessing basic care or major care, you just have a $50 deductible to meet on yourself, up to $150 total between you and your dependents. And it's just $50 per person, so if it's just you and your spouse, 50 and 50 is not 150. But that only applies to basic care and major care. It does not apply to preventive care. You will not pay a dime when accident is preventive care. Questions regarding the dental plan? Pretty straightforward though, as you see, and nothing changing really besides the name. Here's the rates. Obviously, it's a lot lower costing item. It's just dental care. Benefits are a little bit more subdued. But obviously something that if you go get your annual cleanings, your annual cleanings once every 6 months, this benefit more itself pays for itself. So,
Can I have a quick clarification for everyone? When Jerry said we've got the 26 pay period employee rate and then the employee rate 52 at the quarry, those are the same rates. It's just divided up amongst 26 pay periods or 52. So there's no preferential one way or the other if you're Legacytouch or if you're with the rock quarry. It's just divided by a different number. So I wanted to make sure.
yeah, I'm sorry if there's any confusion there, but yeah, just your number is 26. You don't have a discount rate. They have the same rates that you all.
Yep.
Guardian, along with Mutual of Omaha, do have other value-added services as well. So if you do not utilize your full benefit maximum of $1,000, they do have a rollover program, and it's highlighted in your Guardian packet here how it works. So that if you don't utilize it, you can, I think the first year you can roll to $250. So now if you re-enroll into it the next year, now your benefit maximum is now gained $250, so you have a $1,250 maximum. Then I think if you don't use that next year, you can roll to another $500, depending on how much you've used. But just note that you do have the ability to roll over these funds so that you're not just, it's just not $1,000 each and every year. So a nice little benefit there. They also do have a college tuition benefit program. Kind of a nice little cutting edge deal that they've put in place over the last couple of years, that for all the premium dollars that you put in, each dollar equates to a point that accrues towards this college tuition program. You do have to sign up for it. The information is in here. But if you do have kids that are approaching going to college, maybe in high school, even middle school, every dollar that you spend, so let's say you maybe taking the family plan, you maybe paid $1,000 in premium, that's 1,000 points that's put towards your college tuition program. That would go towards, it has a full array of colleges. It's not every college, they have like a full listing. So upon signing up, they'll show you that full listing. But something that's a nice little discount if you did have a child or a student go to one of these institutions within their program. So nice little benefit there. They do have a nice little EAP program. So any type of legal situation that you may be in, you might have access to get discounted services there. Any type of counseling, mental health, anything there, maybe access to regarding their EAP program. As I noted earlier too, you do have access to another EAP program with Mutual of Omaha, in which that will be sent to you on a separate basis. That will go in, on an individual basis upon signing up on some of their voluntary items. Vision, as mentioned, is moving to IMED. Pretty great plan here, I'd say, a little bit more vast network with than what you maybe have with Lincoln. The plan design actually matches more so what you have with Lincoln too, so we're not discounting benefits here. And we did see a nice little great discount too. You go get your annual eye exam at a $10 copay. Just go get your annual eye exam. I could attest that I am not on a vision plan. I went and got my eye exam done the other day being about 6 months ago. It was about $100 for me to go get it done. So just know about $90 in savings just to maybe pay your $6 per month to be on that vision plan then. If you're someone who wears glasses or any type of readers that maybe have a prescription in to go get your updated lenses, it's just a $25 copay, whether it's enhancing your prescription in them, getting them for the first time, or fixing a scratched pair, $25. Frames, you have a $130 allowance towards a new pair of frames, plus a $20% discount after that $130 allowance. So let's say you go and get a $230 pair of frames. You've had $130 that's covered it, you have $100 left to pay, you'll get another 20% discount there, you're only left paying $80. If you go to some of IMED's preferred, I would say providers, that is, Target I know is one of them, but they can actually give you a new pair of frames at $0. You guys have got a few bits of information on it. You'll have more information loaded onto Employee Navigator, but they'll show you how you can get that get that enhanced benefit offering for frames that maybe you need to get. And you get a new pair of frames once every 24 months. And that will restart over if you've already got your new pair of frames with Lincoln. Since you're going on to a new program, and you can go get them starting March 1st or after on this one. And then contact lenses, same type of deal. You can get a $130 allowance and a 15% discount. And that is in lieu of lenses. So if you've already used your lens benefit, then you do not get the contact lens benefit. But if you use your contact lens benefit, then you can get your lens benefit. So just note that. But you still have access to discounts. So I would say the reason why a vision program is usually so cheap, it's not there to cover everything. It's there just to give you access to care and access to discounts if and when needed. Questions regarding the vision plan? There's a contact lens exam. I think that what I'm showing here is just kind of a brief highlight there, but it should show a contact lens exam benefit, copay that you'll pay. Yeah. All right, and lastly, to kind of wrap this whole thing up, it's going to be the Mutual of Omaha products. Legacytouch offers you guys all a basic life policy that they pay for you all. It's going to be one times your annual salary. So if you're paid $50,000, you have a $50,000 benefit. It does have the accidental death and dismemberment portion. So, God forbid, if anyone happened to pass away in a car wreck or something, your benefit would be to pay double. $50,000, let's say it was $50,000. $50,000 for the life, and then $50,000 for the AD&D portion. Your beneficiary will get $100,000 in total. Okay, because it's only due to an accident, it pays that double enhancement there. Then you got your voluntary short-term disability. It pays 60% of your weekly income up to a maximum of $1,500 per week, and then to a minimum of $25 per week. Obviously, it's not there to really offset your total income. It's there to just make sure you're covered to help provide coverage for your expenses throughout that disability. $0 waiting period if in an accident. 7-day waiting period if it's due to sickness. Then you have a benefit maximum of 13 weeks on this plan. So it's not there to last forever, it's just there to help in the short term, thus short-term disability. You have also the ability to elect the long-term disability as well. 60% of your basic earnings to a maximum of $6,000 per month. Definition of disability is 24 months of your own occupation. So that means if you're totally disabled and not being able to come back from work, if you are not totally disabled and not able to come back to work in a limited capacity, you're still going to be able to collect on unlimited disability on this plan. Obviously, you have an elimination period of 90 days, so it's thus more there to pick up after where short-term disability might end. So you can get both, you can get one. Your short-term disability is going to be a little bit more expensive to have, and there was a little bit of an increase in the rates, unfortunately. We received a pretty big hike from Lincoln. But we were to help offset some of that increase, moving over to Mutual of Omaha. But obviously, going to run a little bit more expensive, because you're thus more likely to get disabled in the short term as opposed to long term. And there was no rate increase then on the long term disability. Those rates are staying the same. And those benefits will run out to your Social Security retirement age on that. Questions regarding the two disabilities?
What's the age limit for the short and long term? Is there an age maximum and minimum? No.
Nope. I mean, so yeah, obviously, you can't, I think obviously at age 65, your benefits will terminate, or upon retirement,
Right.
They do run out.
Okay.
Whether, obviously, which is the Social Security retirement age, but there's no age limit. Obviously, the younger you are, there's going to be a different, younger or older you are, you're in an age band on what your rate will be. And then lastly, to kind of wrap this all up, is the voluntary life. So for those that already have a voluntary life policy with Lincoln, that goes over the guaranteed issue amount of $80,000, that is grandfathered over. So if you have $150,000 in life insurance right now, you will not have to fill out an explanation or an evidence of insurability form. But if you want to elect over this $80,000 guaranteed issue, and you do not currently have it with Lincoln, you will have to fill out an evidence of insurability form. But if it is $80,000 or less, you have that as a guaranteed issue to yourself. So no medical questions whatsoever. First time offering, you can get $80,000 of coverage on yourself. For your spouse, they have a guaranteed issue of $100,000. If they go above that, or if they do not already have that policy in place today, they will have to fill out an evidence of insurability form. The evidence of insurability form will be loaded onto Employee Navigator, and it will prompt you if you go above the guaranteed issue to have it complete. You can also enroll your child on a $10,000 policy. It's no less or no more. It doesn't matter if you have 1 kid on it or 4 kids on it. It's the same price. It's very cheap. It comes out to about $2 a month. Just there to offset anything in the event that there was a claim on it. This does have the AD&D portion, as I kind of mentioned, accidental death and dismemberment. If the claim was due to an accident, pay double. Policy will pay on life as well as on the AD&D. You can see that, you'll see that increments of $10,000, and that's going to be all loaded onto Employee Navigator. So you guys have all utilized Employee Navigator, either every time of your new hire or at the time of open enrollment last year. You'll toggle between everything, and it'll show you what your cost is going to be, and it's based off your age, and then what you can do in increments of $10,000, as well as for your spouse. Your spouse can elect up to 100% of what you elect. Obviously, though, you'll see that they may have to fill out an evidence of insurability form if it's above the guaranteed issue. But as I mentioned, if you have anything above those guaranteed issue amounts, you will not have to fill out an evidence of insurability form. Questions regarding the voluntary life? And it's laid out pretty easily for you all, how you can toggle back and forth and see what your rate is based off the policy amount that you want. But just know you are grandfathered over if you have anything over the guaranteed issue. All right, and then obviously, as we kind of touched on already, then to kind of get this thing wrapped up, and we appreciate you guys' time here this afternoon. All open enrollment is going to be opened up on the portal for Employee Navigator. In your packet, you see this form in there that helps gives you the instructions to get logged back on. If you've forgotten your password and can't get it restarted, please contact Kim, please contact Marcia or myself. We'll get you guys your password and get you all reset, and we'll get you going on the portal. I think the portal opens up in about 20 minutes, so for those that want to go get this done right away. But you do have until February 15th to get this done, so 10 days from now. So just know, the sooner you're able to get this thing completed, the sooner we can get it all turned into the CARES, and the sooner we can get you all your ID cards and your ID numbers. So we do appreciate you all and having taken time to fill out those easy apps you guys did in a timely fashion. If you could be just as fast with that to get this open enrollment done, just know that you're doing yourselves all a favor to get everything processed and implemented with the carriers, and that's why we'll get you guys back the information that you all need to get to your guys' provider set up with your new information. I can stick around for any questions you have maybe now. If you want to grab me one-on-one, I'm more than happy to walk you through anything. If you have any situations that maybe we want to walk through, I'm more than happy to. And so you've got my contact information, you got Marcia's contact information. If you guys have any questions while diving into this later on in the next few days, whenever you get a chance, please don't hesitate to reach out to us. We're the experts on this. We want to be able to help you out the best we can. Again, thank you guys for your time this afternoon. Flip, Chris, thank you guys so much. You guys do offer great benefits here, and attest to that. And if you guys have anything, appreciate it. But be safe out in the weather and safe trip going home.
And he'll stay here for a few minutes. Don't leave yet, because we got something else to talk about. He can stay for a few minutes afterwards, and if somebody has some personal questions. Don't forget that he's on our side here. He's not trying to figure out how to nickel and dime us and trying to get the most money for him and the least benefits for us. It's not the way this works. Jerry's here for us, to help us, to maximize what we can get. With that being said, Brett's got a few words.
Well, due to the weather again, like yesterday, we're going to go ahead and early release today again. So seeing that we're about 12 after, I think 4 o'clock would be a good time. I know that production still has some express orders to get out. There's just a handful to get done. So we're going to allow them to get back, get those worked on. Everybody else kind of wrap up for the day and plan to get out of here at 4 o'clock. Only reason we're doing this is so people can take their time getting home and avoid some of the rush hour traffic. And of course tomorrow, I think it might be a little bit dicey coming into work, so just plan for it. We'll be here, we'll be open, we also need to get here, but, you know, plan ahead, leave early, plan for a slow commute in, and do your best to get here and to be safe, so.
And don't forget, guys, we're doing this for your safety, so it's not so you can go out and get a jump on your party and whatever